Hello, my name is Artem Dudin. The project location where I volunteered at is La Ceiba, Honduras, and I came here the 20th of December 2014, and I am leaving the 3rd of January 2015. The places that I volunteered at is the clinic Atlantia and the hospital Atlantia. The local abroaderview coordinator was very helpful. I was just a really nice guy. Raphael provided us with many opportunities to serve in La Ceiba in the clinic, and as well as made sure that we were able to get into the hospital Atlantia and volunteer there, which was really interesting for me. Also, Raphael helped us in getting us comfortable in La Ceiba and made sure that we got to know the city and the surrounding areas. Some of the surprising things, or some of the things that stood out to me about the program, was how we were able to volunteer at the clinic and the hospital, and just some of the things that they're in need of, or the lack of supplies that they have, was just something that kind of stood out to me, and I didn't really experience that in the US. Also, at the accommodation, there was really surprising was the friendliness, and how friendly they were, how nice they were, and how happy they were to see us and help us out. They really made us feel at home and welcome. And about the country, it was not really surprising, but just kind of stood out to me was just kind of the corruption that sometimes goes on and that you hear about. I didn't experience any myself, but just hearing about it. Also, the economical economy, how low it is. Compare this to the US, it's just kind of evident, but not very surprising. I didn't really experience anything difficult during this time that I was here, but for some people it might be difficult for how the shape of the overall shape of the clinic, how it is, the lack of supplies that they have. It just may be hard to understand. At the accommodation, there wasn't really anything difficult for me. For some people, maybe the cold showers might be a little bit difficult, might be a little bit hard, but really when you know that it's warm here, it's really easy to get used to. Overall, one of the most difficult things for me was not knowing enough Spanish, but really the people around here that I work with knew a lot of English, so I was able to understand and be able to communicate. As for future volunteers, the type of clothing is usually light clothing where you'll be able to keep cool, have at least one nice outfit for going out somewhere. If you're volunteering with health clinics, then get some scrubs, also get some swimming suits for spending time on the beach. Shoes, flip-flops are some of the things that I would say. As for donations, what I kind of noticed what they were in need of was blood pressure cuffs, some gloves for working in the hospital, as well as suture kits. They were really in need of those at the hospital, some gauze, and then scrubs for the local nurses. As in terms of weather, it was sometimes rainy, but not really. So for the rainy days, an umbrella might be good. Maybe some rain boots. But really, for me, I got by fairly well. Also, some important things that you might want to know is that you should really know the city and how to stay safe and where to be safe. Also, be very open-minded and accepting a different culture from maybe what you have experienced before, so be ready to welcome that. Being here in Honduras for 2 weeks, it at first seemed like it would be a long time, but as I was here, it seemed really short and it flew by really fast. And I felt that it was nice to know that while I was here, I had a purpose here, and I was able to do something useful for the people here. Also meeting and making friends with the nurses, the doctors, coordinators. Helping them out was really a rewarding experience for me. Some of the accommodations, in terms of accommodation, meals, and security, it's wasn't really hard for me to get used to, because I mean the accommodations was no air conditioner and cold showers, which kind of complemented each other. And really, if you think about it, it's not that big of a problem. And the meals are very nice, and I enjoy them a lot. As for security, as long as you know where you are, aware of your surroundings, and know where to go and when to go, different places, you can be fairly safe. Also, the thing I liked is that the hosts are usually make sure that you're well fed, and the food here is really good. Some of the favorite memories on this trip is in the program was just working in the emergency room at the hospital Atlantia. The nurses and doctors are very friendly, and it was a great experience. They let you see some things and do help them out with some of the jobs, and it's really just a rewarding experience doing that. And in terms of overall, my favorite memory of this whole country is just the food and how friendly the people here are, how welcoming they are. It's really something that I'll definitely miss. When I was contacting the abroaderview volunteers prior to coming here on the website, I used email and online chat on the website, and they're really good about answering my emails fairly fast, and they were able to answer any questions that I had. The website information was really helpful. Also, personal testimonies of people when they were here before really helped me out to know what to expect here. And I will definitely be willing to speak to other volunteers if they have any questions.
Thank you, Artem, for being volunteer with abroaderview Honduras. Have a safe trip home, and we hope to see you back very soon.
Thank you.